Hi, I'm Dr. Bob Willis. I'm the Chief Medical Officer for Cenegenics Medical Institute and the CEO and Chief Medical Officer of Cenegenics in Boca Raton. And I'm here with my friend and guest, Dr. Cesar Pellerano, who is going to tell us about the advancement of medical screening using an intimomedial thickness as a predictor for cardiovascular disease. Cesar, tell them who you are.
Hello, my name is Cesar Pellerano. I'm a preventive cardiologist in Miami, Florida, and I'm the Chief Medical Officer of Cenegenics Miami. And today we're going to be talking about our Panasonic machine to evaluate the CIMT. Now, what is CIMT? With this machine, in a non-invasive manner, we can just look at the carotid artery, which is going to mirror a lot of the other arteries in your body. And by measuring the thickness in the wall of these arteries, we're able to identify if there may be presence or absence of disease in this artery or other arteries in the body. At times also, we may be able to show that a person may already have developed some degree of disease. And this machine is also going to be able to tell us that. So now we're going to show you how the machine works. When the patient comes in, a significant amount of information is put in, individual to the patient. And by putting all of this information together, we can then evaluate the particular risk of that patient.
Evaluating it by, again, remember that we did the blood work. Now we're evaluating how the arteries are. How do they look? Not just in the carotid artery, but throughout the body. So this is a mirror of other arteries in the body. And the information about their fat and the other blood work has already been entered. So we're going to go right to a report.
Okay. So when we look at the report, the preliminary part of the report is going to show us how the risk is stratified just by looking at the patient's blood work that's already been entered. Their blood pressure has also been entered, and we're going to be able to identify the rest of the blood work right here. Okay, so when we look at this section and we're actually looking at the ultrasound of the artery, we see that this person is falling in this red line, and this line is definitely too thick for that person. We're then able to look at the other artery and isolate both the left and the right. So by looking at the other artery is also thicker than what it should be, but not as bad as the original artery.
So basically, what Panasonic has done in the medical field is they've taken a machine that required a technician, and through their software development, they've allowed us to be able to go to the same spot every time we do this study. So whether we do the study in 2012 and then repeat it in 2013, we know exactly the angle of the probe and where this machine will lead us so that we can measure progression of the disease, that is, if it advances, but most importantly, at Cenegenics, we're looking at reversing this disease through our lifestyle modifications, through nutrition, to modifying the lipid panels, that is, the fats in your blood, the cholesterol, the triglycerides, and other fats, to lowering your clotting mechanisms. And also, at times, we believe that our program, which includes optimization of hormones, nutrition, and exercise, together will show that we can not only lower the risk of cardiovascular death from stroke and heart disease, but we can also reverse what already exists. And that's really the key to this. So we have taken on an approach that says we are about to attack the two major causes of death, heart disease and stroke. We're going to reduce the risk for those who don't know they have it, but we're also going to take those people who have cardiovascular risks, and we're going to lower their risk factors through our lifestyle modification, through our nutraceuticals, through using the medicinal needs that we have to lower certain lipid profiles. And the thing that is very, very, very unique is that this machine, the ability to look at an artery non-invasively and know what's going on in the rest of the body. That's the key. The key is we know what's going on in the rest of the body. IMT is a very, very good predictor of whether or not there's thickening and inflammation, as well as whether or not you're building up debris inside of the artery. And it's those people who have very thickened arteries. If they have inflammatory markers, they're at risk of having cardiovascular disease or peripheral vascular disease or even abdominal aortic aneurysms. How accurate is the machine? It has about a 94% specificity for showing us thickness of the wall, and then we have to look at the other risk factors, the blood work and the other things, to determine how important or how that one measurement is by itself is not totally important. We need everything else. We need the blood work to tell. IMT alone is just going to tell us you're at risk. It isn't going to tell us any more than that. But it is a great tool, non-invasively, to know whether or not you have vascular disease.
And there are also numerous medical studies that have shown a direct correlation between the measurement of the IMT, the ability for an artery to get reclogged if it's already been opened, like in a patient with a stent, correlation with the IMT for heart attacks, and correlation for IMTs with peripheral vascular disease. So prevention of stroke, prevention of heart disease, and prevention of peripheral vascular disease have all been tied with numerous medical studies to the measurement of the IMT.
And if you combine that with genetics, lipid breakdown, inflammation, we have a very, very good test to predict the risk for cardiovascular deaths and for strokes, and that's really our target, prevention. So thank you for joining us. Again, call Cenegenics and come in for your heart disease and stroke prevention program. Thank you, Dr. Pellerano.
Thank you.